in the mother. The mother herself is at risk. Now for the baby, short term, that is if there's no history, if the baby doesn't end up being born in stillbirth, they run the risk of having some congenital abnormalities. They run the risk of being born prematurely, and for premature babies they have a lot of problems, including respiratory problems. Now they also run the risk of being very big at birth, such that the mother would require surgical interventions, cesarean section. Then also at birth, funny enough, they have very low blood glucose at birth. So for somebody who is not knowledgeable taking such a delivery, the baby could die if they don't know that this baby has low blood glucose. But long term, such a baby is at risk of developing or becoming obese and developing diabetes. Okay. Now for the mother, short term, what happens if gestational diabetes mellitus is not detected? She runs the risk of developing preeclampsia, where they have high blood pressure in pregnancy and they start fitting, they start having seizures. She develops the risk also of going into premature labor. Then, of course, the risk of cesarean sections and all that. Then, ultimately, when they deliver, the blood glucose could go back to normal. But for some women, once they are done with the delivery, that is the beginning of diabetes for them. It doesn't go away. The blood sugar remains high. Yes. But for those whose blood glucose remain normal after delivery, they are already at risk of developing diabetes.
Wow. This year, the World Diabetes Day, the focus is on women.
Yes.
Now, data suggests that women are stigmatized against, women who have diabetes. Where did they get that from?
Well, I don't think it's much of stigmatization as having access. Women already have equitable access to health care, affordable health care in terms of preventive and management. And women, they are kind of the backbone of a family's health. And I'll give you some figures. Do you know 1 in 9 women live with diabetes? 2 in 5 women in the reproductive age group have diabetes.
But I'm sure that most of these women have not presented at the hospital.
Yes, because as I said, they may not have symptoms. So we are trying to promote access to these strategies, preventive strategies and care. That's why we are making this much noise in the World Diabetes Day.
But I'm aware that a woman at least has the privilege of getting tested for diabetes when she goes for antenatals. Now, doesn't that catch most women?
I don't think this is offered in every hospital. Where do women go to when they are pregnant? Not everybody goes to the tertiary facility or the secondary healthcare facilities. We may have some hospitals that don't really offer this routinely. So I would suggest that women above 25 who are pregnant should be screened routinely at 24 weeks to 28 weeks for diabetes.
Okay. So I know that women, they care for children.
Yes.
Some of them care for grandchildren.
Yes.
They're walking around the house looking for what to cook, to eat. And then some of them are employed.
Yes.
And one of the problems of diabetes, it has so many problems.
Yeah.
Foot sores. So can a woman have diabetes with foot sores and keep herself from being infected and maybe ultimately having an amputation? How difficult is that?
Well, first of all, women are good at multitasking. Let's start with a woman with diabetes could actually stay free of complications and have good quality and good quantity of life. Now, but if such a woman, for some reason, goes on to develop diabetic foot ulcers, then it becomes a problem because many things will be granted at the home front and at the work front. So we don't even want them to get to the stage of developing complications.
Okay. So, you mentioned the complications of a woman having diabetes when she's pregnant,
yes.
Complications for the child, complications for the woman.
Yes.
But what if the woman is diabetic before she gets pregnant?
Yes.
Does it affect her ability to conceive?
Well, there are studies that have shown that women with diabetes who have poorly controlled blood glucose could have a problem getting pregnant. And even when they get pregnant and they still have that poor glucose control, they run the risk of having stillbirths and having complications. So it's all about keeping the blood glucose within normal, whether the woman was known to be diabetic before pregnancy or developed the diabetes in pregnancy. So long as the blood glucose is controlled, then they will be free of complications. So it's all about normal blood glucose, no complications.
Doctors say that what usually leads to a diagnosis of diabetes is not the symptoms, not that the patient is feeling,
yes,
oh, I'm so thirsty, I'm so hungry, you know, I can't see well, or stuff like that.
Yes.
That's not what brings them.
Yes.
They're just caught.
Yes.
That is frightening.
It's frightening.
What would you like to be bringing your diabetic patient to the hospital?
No, for people who are already known to have diabetes.
No, I mean, you get a patient who is coming for something entirely different.
That is what
hip pain or malaria.
Thank you.
Then you discover diabetes. How would you prefer it to happen?
That's why the message we have been preaching for the past week is opportunistic screening. Somebody who is 40 years comes to the clinic, I have a headache, or she comes to check her blood pressure. You must offer glucose screening, diabetes screening for such a person. So that's the message we are passing out. Anybody above 40 should be screened opportunistically in the hospital. Now, if there's a family history of diabetes and the person is obese and the person is less than 40, maybe like 35, then the person should get opportunistic screening.
What's the connection between the obesity and the diabetes?
Well, the connection between obesity and diabetes is that when there is obesity, there are certain hormones that the fat tissues produce. They work against insulin. I remember I told you that insulin tends to keep blood glucose within normal range in the blood. Yes. So the obesity works against the action of insulin. That's the relation. And sometimes the person may not have generalized obesity. I mean, overtly obese. Sometimes it's a fat in the stomach, and that is the worst kind of fat.
Okay, visceral fat.
Visceral fat, thank you.
All right. Now, you keep saying that if a person does what is right,
yes,
diabetes can be delayed or it can be prevented.
Yes.
We'll come back from the break and we'll talk a bit about that.
Okay.
We're going on a short break now. Please stay with us for the rest of the program.